Hey everyone, how's everybody? So this is an exciting topic for me because I gotta say HIM's been very kind to me as far as a career path. It's got so many different levels and different, I would say, legs. And like Samantha, I got into it by accident as well. um, I remember just needing a job, working as a clerk, and really not really understanding the full dynamics of what medical records was back then. But for the future, professionals, there's so much to get into now. It's not just about pushing paper or or collecting charts. It's so much of the skill sets that warrant you to go far. Samantha, we and I want to talk about the different divisions within HIM that people can explore as far as a career path. Mhm. Right, right. Right, right. And that's where your QA comes in, right? Because those frontline people who are looking at those documents, they have to be keen on what they're looking at, right? For instance, there was a joint commission survey, and um, the I would say the one that they got the thing that they got in trouble with was the consent for transfusion. They didn't see it on chart. And for some reason, for some reason, of course, HIM got blamed for it not to be there. But what it was it was not signed off in their nursing department because nursing is truly responsible for that, and that needs a signature. So that is a scanned document that wasn't scanned. They did eventually find it, but again, the responsibility to audit something that's missing is really kind of, I would say, inter responsible, if that's a word. But always HIM always ends up being responsible, right? Yeah, but that's your QA. Um, Right. 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 Mm-hmm. Right. Yeah. And remember, those numbers get reported to the state. Right. So it has to be accurate. You have to have really a good eye for accuracy. Definitely. Right. 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 Hmm. Absolutely. Yep. It's too hard. It's all problem area. It's too hard. Mhm. 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 Right. Yeah. It's I always call it the problem area. You have, when patients are requesting their records, I want it now, right? Yeah, you don't know what the story is behind, those requests. When you want to be not only compliant, but you want to be compassionate too. Especially when there's an urgency for a patient to request their records. But we all have to abide by the rules. Hmm. Right. Right. Mhm. Right. Hmm. Right. 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 Exactly. Exactly. Again, back to, the medical legal responsibility of us being a record keeper and a gatekeeper of a record. Hmm. Hmm. Identity management. Mhm. Our little HIMer. Hmm. 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 Right. So let me tell you a funny story about identity management. So I would say in the early mid 80s, my first job was being someone that they call the debold. For those who remember those big machines, they were gigantic index card machine. Literally thousands of index cards in this big, gigantic Rolodex that we were able to manually maintain to see if the patient was here before. It was a 24-hour, 7-day a week operation. The emergency room or the registration in the clinics would call that number for you to check to see if Samantha Lugine was here before. And you would go by an alphabet, of course, process where it was not like a terminal digit, but we would do it by, of course, your last name and your first name. But again, that mistakes happen. You issue a number to Samantha, to Sam, to Sammy. You know, right, right. So a lot of mistakes on the manual process, but it's the same that can happen on an EMR when you're registering, right? Whatever name they feel like giving you that day, that's the name that you're going to register, and you see in the system that it doesn't exist. So here you have a duplicate and don't even know it. But that was I'll never forget, that was one of the craziest jobs I had, but I didn't realize back at that time that that was important. Yeah, yeah, yeah. And then like you said, there's a whole big explosion in that field where you have companies who are really thriving in that business. Who knew? 24/7. I was the midnight to 8 clerk. I was the midnight to 8 clerk. Yes, yes. I remember that. And I used to get stuck on doubles when somebody calls in, almost like you were a nurse. It was crazy. You had to man that. And then if you went to take a break, you had to call the ER, issue them a group of numbers, about 5 or 6 numbers while you take your break. And then you come back and you call them and say, what numbers did you use? Uh-huh. Uh-huh. I know. Thank God. Hmm. Right. Hmm. Right. Absolutely. Right. Right. Ahima. Right. Right. Oh yeah, yeah. For the, yeah, the provide the pro fee side. Yeah. Hmm. Hmm. Right. Right, right. Yeah, I've encouraged quite a bit of staff and team members into exploring. I mean, listen, being a coder in an HIM or medical record department back then was like they were the elite. It was like the level. Right. Coders were always looked at as the bar has been raised, right? That people strive to go into coding. And back then, years ago, there wasn't a formal training. There was a grandfathering into the profession. That if you got on the job training, you were lucky. I was at one of the very first formal instructing schools at downstate. Yeah, at SUNY downstate. 1986 was one of the first formal coding training schools. And Dr. Isaac Toper was the dean at the time, and I know that some of my colleagues remember him well. But you did not get formal training back in the days. It was always on the job. So the best thing always is to go to a formal training program, as Samantha has suggested, and maybe even go to an advanced degree to get the RHIT, and so on and so forth. But a DRG validation is an advanced coder, who's very key in that, and that's another step, above a coder. Coders can break out between being an outpatient specialist or an inpatient specialist. Mhm. Yep. Mhm. Yeah. Right. Mhm. Yeah. No, 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 it was a third party. It was a third party, yeah. Mhm. 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 Yeah, and I have to say to you that that has now become the core of HIM. So most organizations now split between what we call operations. So we just discussed all of those career paths in operations, ROI scanning, deficiency tracking, IM, and then you have revenue cycle side that's only focused on the reimbursement, and the revenue cycle realm, of these healthcare organizations. um with even that, it goes even further before you hit a director level. It's also auditing, and most of the time that's coincides with ROI, because they're the ones who are releasing the information to the requesters or the auditors, whether it's a state auditor, whether it's a payer audit, any kind of regulatory request, risk management. All of those are relevant to a collaboration between an operations and a rev cycle side. Yep. Hmm. Hmm. Yeah. But as a whole, it becomes really key that the interconnection of each of those areas, it's almost a domino effect, right? You can't really code a chart, unless the analyst review the chart, right? And you can't uh, really would say be able to do deficiency tracking with a chart unless you have identity management taking out that dupe. So it's all interrelated. Mhm, mhm. Yep. Right. Right. Mhm. Oh yeah. Right. But Samantha, remember, well, even where you used to work, your department was set up that way that it was assembly line. You know, yeah, yeah, and that's how most organizations set themselves up. It was this part of the department was this part, and it literally was a physical movement of these charts. Yep. Hmm. 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 Right. Hmm. Hmm. Right. Hmm. Right. Right. It's now become a very respected, I would say, realm of the healthcare organization. It wasn't. We were the basement rats. It was paper pushers. It was all of that. But now we are regarded highly as part of a key partner in the healthcare organization. So we've arrived, I believe. Right. Hmm. I think they have a roadmap too. Right. Hmm. Thank you. Goodbye, everybody.